We're going to review Trivellini system and how it works. Trivellini is a multiphasic extraction device. The reason we need a multi-phasic extraction device is that we don't want to go with the same speed and same energy into different layers of the skin. So when we are extracting here, superficially we have thicker, denser skin. So we have to cut through the skin easily and go all the way in. So if we go with a lower energy or not enough power, we cannot cut through the skin. When the initial phase is not done right, the whole procedure, the whole extraction procedure will be not probably done as well as we want it to be. So that first phase is very important. We have first phase and second phase. The first phase cuts through the tough portion of the skin. The second phase is just liberating the grafts that are ready to come out. First phase is more energy, second phase is low energy. If you use low energy on the first phase, we cannot cut through the skin. If you use high energy on the second level, we're increasing the chance of transecting grafts. So let's look at the diagram here. So if this is the skin, the superficial layer, epidermal and superficial dermis, is very dense. So this is the dense area, okay? And let's use a red color for our hair. Our hair is gonna go like this. This is the hair follicle that we want to extract. So when we want to extract these, our punch comes in, the first phase goes all the way through this and cut through the skin. So that superficial layers of the skin needs more energy. We usually use rotation, maximum energy to cut through this, but this is very superficial, only 1 millimeter. When we pass that initial 1 millimeter, we can go in and out real quick, but still, if we go with the same energy, there is a chance that this edge of the punch comes very close to the hair follicle and we may damage the follicle. We may get transection or pairing of the grafts, or we can miss the graft altogether. So Trivellini system is helping us with this. So here's the system. Let's focus on two phases, phase 1 and phase 2. Of course, you can add more phases. When the machine, you start using the machine, you see that one phase, you can add mode to it. So in this case, the first mode, we want it to be very sharp, very powerful to cut through the superficial layers of the skin. So the best thing we can do is rotation with 100% power. This power could be adjusted. If you have a skin that's fragile, we can go to 80% or even less. But I like to use 100% because there's not much of a problem when you cut through the skin with 100% for the first millimeter. The first millimeter, there's minimal chance that you can transect anything. So use the maximum power, even if you have to increase the time, so you can adjust the time. I can use 200 milliseconds for the first phase. So when we cut through the first phase, then we start the second phase. So at this point, we are done to cutting through the skin on the first phase, and then we're ready to move on to the next level, meaning we're cutting the top portion of the skin and we are waiting to liberate the grafts from those fatty tissue around it. Think of it as the hair follicles are floating in a pool of fat. They just need to be liberated enough, just loose connections needs to be cut. So we don't have to go that harsh and that strong with the rotation. So we switch it to something else. So we're going to add the second mode as oscillation in this case. So we're adding oscillation. We have control on the power of the machine, how fast we want the machine to go back and forth with oscillation. In this case, we put it at 60%. And also I can change the degree of rotation, or I'm sorry, oscillation. So that oscillation degree, I put it to 300 degree. So in this case, we're not going with full energy and we're not going with full rotation or more than full rotation, which we have it for some cases. In this case, we're going for 300 degree back and forth, 300 degree back and forth with lower energy. That's a very safe mode for the deep layers of the skin and to liberate the grafts, liberate the follicular units without damaging the follicles. So sometimes for the second phase, instead of oscillation, we can use Mamba mode. Mamba mode is a roto oscillation mode, meaning that we have an oscillation with long arch. So we go 2 turn one way and 2 turn the other way. So we go this way and coming back. It's more powerful than regular oscillation, and is used for the cases that we have scarring underneath the skin, or we have very thick or dense tissue underneath the superficial layer of the skin. In this case, we want to put the mamba probably for 400, 500, or even 600 milliseconds, because we want to take our time to go in and out. If you want to add any mode, we can add something like vibration, which is a very short arch oscillation. It goes just vibrate the tip of the punch and just help us to loosen some of those fibrotic tissues that could be down there. Most likely when I use vibration is when I want to finish the last phase. So that's the end to the whole 3 phases basically. So looking at the skin layers one more time, the thick layer of the skin, we did rotation to go into the skin and liberate that superficial layer. So cut through the skin, make sure we're centered, we are protecting the hair because we're not going all the way in. So if the hair is having a splay, the 2 sides are going away from each other, it's not going to be affecting our first phase of extraction. The first phase goes in, get lodged into the skin, cut the superficial layer, and then for second layer we're switching to oscillation or mamba mode, and we go in and out real quick because there's not much resistance usually. So we can liberate the grafts with minimum damage to the hair follicles and with maximum speed, because we don't have to take our time to cut through the superficial layer. Superficial layer could be cut very fast, and we can follow with the liberating the grafts as fast as the first phase. So we go in and out, usually like 500, 600 milliseconds for each extraction of grafts. So reviewing the machine one more time, these are the phases that we have to set up. We can have control on the time of the action or the mode and the power of the mode, and in the case of oscillation, we can control the arch of oscillation. Also on the top of that section we see surgeon 1, surgeon 2, surgeon 3. So this is different passes of extractions. So like in this case we have attempted 800 basically extractions from the beginning of the procedure, and the second phase we're going to mark the second surgeon, and we want to see how many attempts we should go on that, so we won't go totally off chart or we don't lose the track of our extractions. When we go higher, we see this time of beginning, from the beginning of the procedure that is marking from the time that you turn on the machine to the time that you are now. And on the very opposite of that section is the number of grafts. This is the goal that we set for the day. So we know how many grafts we need. So basically that will be counted down as we extract more. That number goes down and it shows us how many more we have to go through. So this whole procedure has been set for 2,000 grafts. We already removed 800, we have 1,200 more to go. And then on the very top portion, we have a Smart React. If you don't want to use the pedal for extraction, for every extraction, if you want to just not be relying on the pedal, you can activate the Smart React. The machine is connected to the suction system. So the tip of the punch, when you touch the skin, it creates a negative pressure that triggers the machine, and with every time that you touch the skin, the machine knows that he has to activate the whole set of new modes. So in this case, we have a delay time too. I usually put it on 200 or 100 milliseconds. So that tells the machine that every time that I touch the skin with the tip of my punch, I have 200 milliseconds to adjust my punch, center it, and then after 200 milliseconds, my phases will get started. So I touch the skin, I go 200 milliseconds, nothing will happen. After that, I'm going to have 200 milliseconds of maximum energy rotation, followed by 100 milliseconds of oscillation in this case. Usually we increase that number to probably 4 or 5. So this is going to be a full pass of delay, rotation, oscillation, and that's it for each graft, and it's going to be repeated exactly the same for every set of extractions.